You took a pill this morning. 10 seconds. Same glass of water, same spot on the counter. Same way you've done it every single day since your doctor handed you that prescription. But if you're over 60, and that pill is Amlodipine, Losartan, or Lisinopril, there's a real chance something is happening inside your body right now that nobody ever properly explained to you. Not because your doctor is hiding it, because they had 12 minutes, and this needed a lot longer. His name was Arthur, and a swollen pair of ankles almost cost him everything, over something with a simple name and a simple answer. Stay with me, because number 6 is the one I'd want my own father to hear. With over 32 years of clinical experience in cardiology, what I'm about to share are the 6 most important things every senior on these 3 medications should understand. So before we go further, do 2 quick things for me. Drop your age in the comments right now, and tell me this. Since starting your blood pressure medication, have you noticed a symptom you quietly wrote off as just getting older? Type it, because someone scrolling these comments right now thinks they're the only one, and your words are going to reach them. And if clear, honest guidance is what you've been looking for, subscribe. I publish every week for seniors who want real answers about what's actually happening inside their body. 6 things. The 6th matters most. Don't skip ahead. Number 1. These 3 pills are not the same drug. Amlodipine, Losartan, and Lisinopril all lower your blood pressure, but they do it through completely different systems, which means different side effects and different warning signs. Confuse them, and you'll misread what your own body is telling you. Amlodipine is the calcium channel blocker. Your artery walls are wrapped in tiny muscle that tightens when calcium flows into its cells. Arteries narrow, pressure climbs. Picture small gates that let calcium in. Amlodipine closes some of them. Less calcium, less tightening, lower pressure. But notice, it manages the output. It doesn't touch why your vessels got tight in the first place. Lisinopril is the ACE inhibitor. Your body builds a chemical called angiotensin II that squeezes your vessels and tells your kidneys to hold on to fluid. To make it, your body needs an enzyme called ACE. Lisinopril shuts that factory down. No factory, no tightening signal. And it eases the load on your kidneys too, which is why it's often chosen for seniors dealing with blood pressure and early kidney concerns. Losartan is the ARB. Same system as Lisinopril, but a different point of attack. Lisinopril stops the signal being made. Losartan lets it get made, then locks the door it needs to enter. The message is sent, but it never gets through. The key difference: Lisinopril causes a dry cough in a real number of people. Losartan doesn't. That's often why a doctor switches you. Not because one is stronger, but because nobody should lose sleep to a 2 a.m. cough when a simple switch exists. Remember which one you're on. The next 5 points depend on it. Number 2. The amlodipine ankle swelling and what it actually means. This is the conversation Arthur never got to have until it was almost too late. Arthur was 76, retired school principal from Alabama, disciplined, not a missed dose in 14 months. Then his wife Eleanor called me one Tuesday, her voice flat with worry. He stopped going to church. I don't even recognize his ankles anymore. Arthur hadn't had a heart attack. He'd been sitting for 3 months with swollen ankles, convinced his heart was failing, even skipping doses on days he had to walk because he was ashamed of how his legs looked. Here's what was really happening. Amlodipine relaxes the small arteries in your legs more than it relaxes the small veins. Blood flows down easily but struggles to flow back up. Fluid seeps into the surrounding tissue. That's why your shoes fit at breakfast and feel tight by 6 p.m. That's why it's gone by morning and back by evening. It is not heart failure. It is not kidney damage. It's a predictable, mechanical side effect of how the drug works on your lower legs. What made Arthur's situation dangerous wasn't the swelling. It was the silence. He hid it, skipped doses, and his blood pressure climbed quietly for 3 months. So, report the swelling. Don't hide it. Skipping doses to cover it up is far more dangerous than the swelling ever was. Number 3. The Lisinopril cough, and the one sign you can never wait on. If you're on Lisinopril, have you picked up a cough since starting it? Not wet, not productive, dry, scratchy, tickling. A cough that nothing clears. Here's the trap. It doesn't always start right away. It can show up months later. By then, people have stopped connecting it to the pill. They blame allergies, dry air, reflux. They buy lozenges. They change their laundry detergent. And the answer is sitting in their pill organizer every single morning. Patricia was 69. 4 months into Lisinopril, a tickle in her throat moved in and wouldn't leave. Sleepless nights, exhaustion. She replaced half the things in her home. When I asked when the cough started relative to her medication, she went completely silent. Nobody had told her the cough can arrive late. A dry cough is uncomfortable, not dangerous. Report it. You may just need a switch to Losartan, but there is one symptom you never wait on. Swelling of the lips, tongue, face, or throat, especially if breathing or swallowing gets hard. That's not a phone call. That's emergency care, immediately. In rare cases, these drugs can cause a reaction called angioedema, and it can turn life-threatening within minutes. Say it with me. Dry cough, report it. Throat swelling, move now. Now, one important thing before we continue. Everything in this video is for general education only. It is not medical advice, and it is not a substitute for your own doctor. Every person is different, and only the physician who knows your history can tell you what's right for you. So please, never start, stop, or change any medication based on a video. Use what you learn here to ask better questions at your next appointment. That's exactly how this information is meant to help you. Number 4, the potassium danger sitting in your kitchen. For this one, don't look at your medicine cabinet. Look at your kitchen counter. Both Losartan and Lisinopril can raise the potassium level in your blood. And when potassium climbs too high, it disturbs the electrical rhythm of your heart. The warning signs are quiet: muscle weakness, a cramp, a skipped beat, sometimes nothing at all until it's serious. Here's what nobody flags. Heart-healthy salt substitutes swap sodium for potassium chloride. Electrolyte powders. Some senior meal replacement drinks. Every one of them quietly loads more potassium into a body whose medication is already holding on to it. Bernard was 74. He switched to a potassium salt substitute thinking he was doing something good for his heart. He was on Losartan. Nobody connected the dots. He got weak, and his potassium came back dangerously high. Bernard wasn't careless. The gap wasn't his discipline. It was his information. So tonight, read the label on every heart-healthy product in your kitchen and ask your doctor one plain question. Given my medication, is a potassium-based salt substitute safe for me? Number 5. The everyday things that turn your meds dangerous. 2 ordinary things in your home can quietly turn a safe medication into a risky one. Neither ever comes up at an appointment. First, the painkiller in your bathroom cabinet. Go check it when this ends. Look for ibuprofen or naproxen. If you take Lisinopril or Losartan, especially with a water pill, using those regularly can cut blood flow to your kidneys and raise the risk of kidney injury. Not because any one of them is dangerous alone, but because together, in a slightly dehydrated body, they create conditions your kidneys struggle to manage. It never gets mentioned because ibuprofen doesn't feel like real medicine. It came off a shelf, so you mention it. Ask your pharmacist this exact sentence. Is it safe for me to use ibuprofen regularly, given everything I'm on? That conversation is free. Second, what happens when you get sick? If you come down with something, vomiting, diarrhea, heavy sweating, can't keep fluids down, the pill that worked perfectly yesterday can behave very differently today. These medications assume a body with steady fluid balance. Strip that away, and the same dose can drop your pressure too far and stress your kidneys. Gerald was 78. Stomach virus, couldn't keep much down. But he took his Losartan anyway, because he hadn't missed a dose in 13 months. That night, he stood up and nearly hit the floor. The drug hadn't turned dangerous. His body had been drained, and his pressure fell too far. Write this on a card and tape it where you'll see it when you're sick. If I can't keep fluids down, I call my doctor before I take my blood pressure pill. Number 6. The truth almost never said on the day you're prescribed. Here's the one. After thousands of appointments, that's almost never spoken aloud on the day the prescription is written. None of these 3 pills erases the condition producing your high blood pressure. Amlodipine loosens how tightly your artery walls contract, but it doesn't undo the stiffness that built up over decades. Lisinopril blocks the enzyme making the tightening signal, but it doesn't repair the vascular changes that made those signals so frequent. Losartan locks the door the signal needs, but the signal is still being sent. All three manage the output of the system. None of them erases the system itself. That's why follow-up matters more than the first prescription. That's why lifestyle isn't optional. That's why a perfect number on paper doesn't mean the conversation is over. The seniors I've seen do best aren't the ones on the most medications. They're the ones who understood what their pill was doing and what it wasn't, and chose to work with both truths at once. So, Arthur, after Eleanor's call, his dose was adjusted, his diet was reviewed, and someone finally sat down with him, not his chart, and explained everything I've just told you. He learned why his ankles swelled. He learned it wasn't his heart. 3 weeks later, the swelling was managed, his pressure was stable, and Arthur was back in his pew on Sunday morning. At his follow-up, he said, "I spent 3 months convinced I was dying from something that had a name and a simple answer. I just needed someone to explain it." 6 months on, he handed a 1-page summary to 23 men in his Sunday group. 5 went to their doctors with questions they'd never known to ask. 2 got medication adjustments that were long overdue. The information existed. The fix existed. The conversation just hadn't happened yet. That's what this channel is for. So, one last question, and I read every reply. Which of these 3 are you on? Amlodipine, Losartan, or Lisinopril? Type the name below. That single word tells me what to break down next. And before your next reading, carry this with you. Do I actually understand what my medication is doing inside my body right now, and what it isn't? If the answer isn't a full yes, that's not your fault. That's the gap this channel exists to close. Subscribe so you never miss the guidance your health deserves before the emergency you never saw coming. I'll see you in the next one.